I'm curious about the evolution and change and how we treat and manage concussions and head injuries and what that means for kind of long-term outcomes, because there has been a big shift in how we manage this injury as compared to, 15, 20 years ago. So there's some exciting research coming out. So I'm always, looking forward to saying like what's next and how we can progress this field to help patients who are dealing with head injuries and concussions. So my name is Kouros Emami. I'm a clinical and sports neuropsychologist here at the Hospital for Special Surgery.
Tell me about your work in general and just kind of what you do.
I am primarily here treating and managing patients with concussions. And that could range from athletes and people that are in like formal organized sports of all ages and all competitive levels to people that get injured in the non-sports area, which, has been an area that in terms of research has not been focused on as much. A lot of the focus has been more on the sports related injuries because that gets a lot of media attention. But there are people that, slip and fall, they get a car accident, they, turn around and bang their head on something. So I am a provider here who sees them from, visit one and treats them and kind of manages their care with a bunch of different specialists here. And we see them until, they're fully solved and back to normal and back to everything that they typically do.
What would you say is actually the sport that causes the most concussion injuries?
For male sports is usually American style football and ice hockey. Female sports tend to be soccer. So soccer is actually, I would say, from what I've read some of the studies, the second highest rate after men's football. And then there are the other sports, wrestling that sometimes gets forgotten. Lacrosse is another one, especially here on the East Coast, and water polo, those type of sports.
You see a lot of people and they need care when they first have a concussion. But also, I saw how you mentioned that there is help for people that have maybe had or have had concussions years ago. Can you tell me what that looks like? And is there a certain time limit? Is there only so much you can do? What does kind of long-term concussion from years ago look like for you as a doctor?
I am a firm believer that any concussion that walks in the door here, we can treat the patient regardless of when the injury is. And we've had great success with that. We've had patients that have come here, multiple years after an injury and they're still struggling. Sometimes it's a student that's, had to take a year off of school, or someone has stopped working and they're on disability leave. And even in those cases, we get them, we try to like reassess everything, start from scratch and just get a clean like lay of the land in terms of what's going on. And in some cases, given the specialty area and kind of the training that we've had in terms of what to look for, there are things that have, occasionally have been missed in the past that we discover, and then we send the patient for treatment and they make remarkable recoveries. Or in some instances, they're behaviorally kind of doing things counter to what would be productive for them. So we try to reassess that and give a lot of reassurance. And it makes sense why patients, develop some fear and anxiety around a lot of the symptoms because it doesn't make them feel well. But a lot of those behaviors are, in fact, like inhibiting them from progressing and fully recovering, which we kind of discuss. It takes a little bit of time to kind of build that trust with the patient. But as they start to feel better, they see that this approach works. And, it's a little by little. I always tell patients, day by day, if you have a bad day, it is what it is. We wake up the next day and we kind of repeat it. We kind of set them up with a good structure that involves, physical activity. Exercise is a big component in terms of how we treat this injury, even in the acute phase. But patients do tend to get deconditioned and, that ramps up anxiety and related symptoms. So we try to disentangle that a little bit. Even in those cases with these former athletes that are having a lot of difficulty, whether it's cognitive stuff, emotional stuff, there is a lot of treatments that are out there that have been shown to alleviate a lot of those symptoms. And definitely there is a mental health component in a lot of those patients. We have great treatments for that, both via talk therapy or psychiatry, medication management. But the message that's been sent a lot of times is that this is kind of like end of the road thing, a doom and gloom thing. And that, you could imagine how much that weighs on someone's mind.
Let's say someone who falls or has a car accident and they might come to see you. Are they at a similar risk at having, brain injury and effects later in their life, like someone who has maybe repetitive concussion?
People come in here with, yeah, like you said, like a slip and fall, and they're like, oh my God, what is this going to mean for me in 30 years? I always tell them that we're going to treat these symptoms and you're going to, we'll get you to 100%. And there's been, there's no indication that one concussion is going to lead you down this pathway where you're going to have, or a real permanent brain injury, because concussion by definition is a mild traumatic brain injury and an injury that is fully treatable. And I'm not worried about their long-term risk because they're not necessarily exposing themselves to, you know, repetitive head injuries because, everyone slips and falls every now and then, but I'm not necessarily concerned for those type of patients.
What are the symptoms that someone could test themselves or someone else to say, maybe I need to take it easy because I might have a concussion?
There are like the big, we call like markers of injury. So things that like we can see, right? So things like loss of consciousness, being completely disoriented, vomiting, just being like completely amnestic and confused on like what's going on, seizures. I mean, those are like very scary things that people see, and that will certainly, if that happens, like there's should be no reason why someone is not taken off the field or. But outside of that, loss of consciousness doesn't always happen. I mean, that's something that a lot of people don't know. The symptoms that are commonly experienced are either like a headache, head pressure, dizziness, sensitivity to lights or noises, nausea without vomiting, feeling foggy, which means like kind of slow down in your thinking. Things feel like a little bit slower to process, some balance issues, and just feeling out of it. So a lot of patients tell me that they just feel out of it. But typically, the most common symptom is like headache and dizziness. People almost immediately feel that, but also in some cases there is a delayed response. So if there is a big collision, right, like if there is a big head-to-head collision or like someone gets slammed into the ground, it's always best to pull them off and get assessed before going back.
I guess the therapy now for concussions is also to stay active, but I guess it's not that active. Like going back and playing isn't necessarily a good thing for solving your concussion. Is that the
Right.
case?
Yeah, so we never say go back fully. So if I get a patient that comes in here, they've been concussed, 48, 72-hour window, we ask patients to just kind of take it easy and relax. What we call like quote unquote relative rest, which does not mean like a full shutdown and go sit in a dark room, which kind of that's how things were done back in the day. There's a period where people kind of scale back their activities, but after that, they can start to resume some what we call like light, non-risk cardio exercise, which typically takes the form of a walk or even at like a brisk walk or a light stationary bike ride. If they have access to something like that, they don't need to do like a formal class, like a spin bike class, but just something to get their heart rate up. But if they don't have, and then they'll do like a 30-minute just walk. And then once they start treatment with us, then we can start to advance them. There's certain like steps we do like progressions to get them back to what they do at the end.
What are topics that you think the media doesn't cover about concussions that maybe you think would be helpful for them to look at?
I think there could be a lot more work done on the treatment options and the fact that there is treatment for patients. I think that there's a big miss there because a lot of the headlines are always doom outcomes, right? I haven't necessarily seen anything out there in the media that says like, oh no, like if you have a concussion, there's treatment for it. If you're having headaches, there's treatment for it. If you're having testicular dysfunction, there's specialized physical therapy that helps patients recover from that. So that I think that's a huge piece. I mean, I think we've done a good job in terms of bringing this to awareness that this is a thing that happens very frequently. But I think we're missing big time on the fact that this is an injury that's fully treatable and everyone will recover.
Are there a lot of people that need help? Is this something that is affecting a number of people? I mean, in terms of numbers of
Yeah.
populations.
Right, right. Yeah, no, I mean, this is a very common injury. I think like in this words area that we CDC quotes like up to like 3 million patient concussions a year in the United States as reported. So if you take into account some of the unreported ones, that number would probably go up. In the summer, when sports season and stuff is out, it kind of tends to shift from, sports injuries to non-sports injuries. But even through the fall and spring where it's more kind of sports heavy, there's a number of patients that get hurt. In the winters, at least on the East Coast and other icy places, everyone slips and falls. Skiing and skating and all that is also like a whole area that does not necessarily always get a lot of attention. And almost every winter there are numbers of patients that come in here with ski injuries and falls and snowboarding injuries and stuff like that.
For people that may have had multiple concussions in the past and don't have symptoms of something that they can see or it's not affecting them negatively, would you still recommend that they connect with you or someone like yourself in order to get assistance before having symptoms?
Yeah, I mean, it's not necessary, but if there's something that they're questioning doing, like starting a new sport, that may have some inherent risk of repetitive injuries, I think it's worth coming in to make sure that nothing has been missed. Typically, what we do, kind of like a comprehensive evaluation to look at vestibular and the motor functioning, which is again something that patients that show up here months later with continued symptoms have, for some people, has been missed. And some providers don't know to look for that. So we take a good look at that. And then also we do some neurocognitive testing to make sure all of that looks good. We do some balance testing, exertional testing, those type of things.
So, how does a concussion manifest itself, and what are the clinical applications that someone would see?
Yeah. So, I mean, there's been a lot of work done on this in the last like 10, 15 years in terms of our understanding of concussion. Whereas previously, I think it was thought of as one kind of homogeneous injury, and it has now evolved into this kind of what we think of as these like clinical subtypes of concussion, or these different like clinical phenotypes of concussions, and we kind of group them in these different buckets. And patients can come in with one of these buckets, all five of these buckets, one or two, and then there is sometimes some interplay between them. So our job is to kind of identify that stuff through our evaluation. So patients typically, can present with what we call like post-traumatic headaches or migraines. They can present with vestibular dysfunction. So the vestibular system is kind of the system of the brain that interprets movement, motion, your head and eye movements and coordination there. So sometimes patients can feel dizzy, nauseous with movement, with exercise. And we know to look for that. And we have formal specialized physical therapy that helps patients recover from that. There's ocular motor deficits that usually take the form of convergence issues, which is people tend to struggle converging their eyes on the target. So that tends to lead to difficulties with reading and eye tracking and things that we do day to day, using screens, which is part of everyone's life now, 24/7, more or less. Um, and then there's cognitive deficits. So we do some cognitive testing to make sure we're not missing anything there. It gives us some objective data on how they're performing in that regards. And sometimes patients do have baseline data, especially ones that play formal sports. So we have some direct one-to-one comparisons to make sure they're functioning well there. And there's anxiety and mood-related issues that sometimes gets overlooked, but can become a big factor in this, especially in the population that does have a lengthy recovery. So, it is important to take a look at that because that can also feed itself into other symptoms and can drive headaches to some extent. And also psychosocial stressors in their life, whether it's work or school. Anyone that gets concussed near finals time almost certainly is going to come in with a high degree of stress. So we try to help students and different people navigate those situations while trying to reduce their stress, but keep them involved to some extent. And we work a lot with schools and try to find like a middle ground to all.
And what are some of the treatments that you use to help them?
Yeah. So an overarching kind of philosophy and treatment approach is an active recovery process. And we kind of, I always talk about this at the beginning that while that does not mean like from the get-go you're going to be running a marathon, it does mean that you're going to be active in all aspects of your life. So that, exercise is one part of it, but we want patients socializing. We want them getting out and doing a lot of the things that they were doing before. Sometimes people have a ton of sensitivity to busy lights and noises, and I know them, practice in New York City, and the city itself is a stimulating environment. So, in a way, it can be its own form of treatment. We have patients going into these environments and help them kind of desensitize a lot of those symptoms. Sleep, regulating sleep. We don't want patients sleeping too much because that will throw off their sleep at night. So we just want to balance kind of normal 7 to 9 hours of sleep. And then more specialized stuff kind of shifts into the vestibular rehab with physical therapy. We have great physical therapists here that do this day in and day out. They, help rehab the vestibular system, and they kind of also do a lot of the exertion training, the formal exercise training, get patients on a treadmill here. And then we give them a plan to get them back and to all of the stuff they did before. So we always ask, like, what is your goal? What do you want to get back to? And then we kind of work our way up to that step by step. They also do some cerebral rehab as well, because sometimes there can be some neck involvement there, especially if there's like a whiplash type mechanism. And then if patients need some vision therapy, if they are having oculomotor treatments, oculomotor impairments there's formal treatment for that. And then in terms of, the mood components, a lot of the patients do tend to recover the emotional aspect of it as they start to feel better, because sometimes it can be like an adjustment to not being involved in a lot of the things that they did before. So if they're, not in school or not exercising, we try to get them back into those areas to help them kind of lift their mood a bit. If it does persist after that, there's psychotherapy, there's medication management if we do need to go there, but the vast majority of patients don't need to go down those roads. And for headaches, I would say, I don't have hard data on this, but just based off my clinic, there's like 95% of patients that I see will recover the headaches without the need of any formal headache medication. So just with good lifestyle, behavioral stuff, headaches will go away. It just depends on where the origin is, where it's coming from, right? So sometimes it's being driven by stress, sometimes it's being driven by oculomotor impairments. If we rehab these things, the headaches tend to go away. But if it's still resistant, then we know there are medications that can help that as well.
So as a final thought, what would you recommend to the World Cup players at the moment?
Yeah, I mean, if you get hurt and you're not feeling right, I know it's the World Cup, it's the biggest stage and things that, you've been working on for your entire life up until this point. It's a once in a lifetime, and 0.001% of the population is going to be in that position, but your brain is important. So if something happens, please report those symptoms and get treated. Your brain is more important than anything.
Thank you so much. It was great to talk with you. And I really appreciate Robin, Frank, and the communications team for telling me about you.
Curious by Nature is a production of Newswise. More than 7,000 journalists get the Newswise wires. Visit newswise.com and find out how to spread your news today.